Okay, so today we're going to talk about Medicaid expansion and care expansion, which I know is an issue that you care very much about. It's one of your top issues, correct?
Correct.
Okay, and you've been concerned about that for many years. About how long do you think that's been on your radar as something to pay attention about?
Probably it really came on my radar about a year before I was elected in 16. Uh, I kind of started to learn that we had so many people in our state that aren't covered. They kind of fall into a coverage gap because where CanCare's Medicaid coverage steps up and where the federal Medicaid stops, there's a huge gap between that over 150,000 Kansans fall in. And so that got on my radar really quick because I think those are the types of people that government are really supposed to work for.
And my apology actually, but to take a step back, could you give me a two-sentence summary of what Medicaid expansion means for the everyday layman?
Uh, People who do not make enough money compared to the national poverty level uh, can be supplemented health care through Medicaid. And the limit for that at the federal level uh, is 138% of the poverty level at the federal level. The states doesn't kick in. Uh, I don't know what I can't remember what the percent is, but it kicks in where you would have to be like 100%. Let's say that's not right, but as an example, so that means people that fall into that, you know, 28, 38% in that gap, they oftentimes won't ever go to the doctor unless it's an absolutely emergency, and they'll be going to the emergency room instead of going to doctors to get preventive care or something early on. Oftentimes they don't go to get items looked at until until it's too late. A study was just done recently that they believe that over the past 4 years that Kansas has not expanded care and Medicaid expansion, that over 300 citizens in Kansas have passed away directly because we do not have Medicaid expansion because those people just did not get the care that they needed when they needed it because they couldn't afford it.
Okay. And can you just for like some example purposes, can you name a few examples of like what is a person in District 98 like? How is that liable to impact their daily life? Like, have you heard specific stories or examples?
Yes, there are a lot of people think some arguments against it are that it encourages people not to work. And there are really no facts to back that up. We heard from a lot of people who actually own their own small businesses. Uh, but one lady in particular I can think of had three small children. She ran a cleaning business. It was her own business. She worked her fingers to the bone. She still did not make enough money. She made too much money to be recognized at the federal Medicaid, but she didn't make enough to be recognized at Kansas Medicaid. She became ill. She continued to work even though she was ill. She did not go to the doctor because she could not afford it. When she finally did go to the doctor, she found out that she had a breast cancer, and the breast cancer had spread significantly because it was not caught early on, and it wasn't caught early on because she could not afford to take off of work, which she owned. She could not give up the time to work, and she could not afford a doctor visit. Last I knew, she was recovering, but most of that was due to doctor and hospital help, where basically doctors and hospital have to eat that amount because they know they're not going to get. Not only do they not the customer unable to pay, but they don't get paid from the Medicaid program. Even the Medicaid program does not pay 100%; they still pay some. So that's one locally, um, and then as far as at the rural level, which I don't necessarily look at, in District 98, but at the state, you have to look at that. We have rural hospitals that are closing all over the place, and I believe at last count there was 12 or 13 that are in serious trouble now, and a lot of it has to do with the fact that we haven't expanded Medicaid because people can't afford their care, and so the hospital has to eat that amount. And if these people were covered by Medicaid, they would at least recover some of that. Right now, they don't recover any of it, but they would at least recover some of it.
Okay. Looking to the past, from a policy standpoint, well, two separate questions. So the first one is, what are two facts, clarifications that you think the average Kansan should understand about Medicaid expansion?
A lot of people complain that Medicaid expansion will mean that they're having to pay to cover other people's doctor's appointments because it's taxpayer driven. They're already doing that. Whenever somebody goes to the emergency room and gets treated, the hospital has to eat that amount if they are unable to pay and they aren't covered by Medicaid or don't have health insurance, and so the hospital has to raise prices for different things. If you increase Medicaid expansion, then that hospital is going to get some of that money back, and that will help them be able to defer some of those prices, and they won't pass price increases along to people. People think that this is going to cost me more money because more people are going to be going on my taxpayer dollar. That's really not true. They're already paying for that whenever they go to the doctor, whenever they're paying deductibles, because those prices have gone up because more people come in that no money is coming into those hospitals or those doctors. Or people that work that don't earn enough money. People can work full time. Our minimum wage is so low that you can work 40 hours a week at minimum wage with a couple of children in the house or a couple of dependents. You still won't make it. You'll make too much money to fall in the federal guidelines, but you won't make enough to hit the Kansas guideline, and you'll fall in that hole. So these people would be covered. And that's been proven again. You'll hear talking points, people who are against it, that it encourages people not to work, and that is just not true, and it's been proven time and time again.
Okay. And so then looking again to the past, what are two major things that happened regarding CanCare expansion while you were in office previously?
Well, I was a very outspoken proponent for expanding Medicaid. So I spoke in several committees. I was also in Health and Human Services, so I heard a lot of discussion. We had hearings in our committee about it. The biggest thing is that we passed it. The House passed Medicaid expansion, and it actually passed the Senate, and then the governor vetoed it. And then that was the first year. The second year we were in, the House passed it, and the Senate basically locked it up in committee where it would never even come up for a vote in Senate, so it never came up to. But the biggest thing we did accomplish, I think, the fact that we passed it in the House with bipartisan support is showing that basically the majority of Kansans want this. And I think a lot of the representatives really began to look at the fact that how many Kansans this is going to help. A lot of people don't understand 150,000 people or to 180,000 people this would impact. There are only 5 counties in the state of Kansas that have more than 150,000 people in them. So literally the majority of the state, which is rural areas, the majority of people don't have coverage, and they need coverage. They need help in all different areas around the state.
Okay. And how would expanding CanCare directly impact District 98? In terms of would it affect, you think, like copays for people now? Who would it help? Who might it impact otherwise?
I think actually in District 98, you probably find a lot of people that fall into that the hole right now, that 150,000 people. I would imagine there's a nice amount of those people that could live in District 98. What it would do, it was enable them that if they're not feeling well, they can go to the doctor with Can Care Expansion with Medicaid and get checked out to make sure that we're taking care of something ahead of time. It's a lot easier to combat a cold if you get on it right away than if you have to go when it's already well established and maybe turning into pneumonia, which is where people will go to the doctor now, is when they just can't take it anymore and they go to the emergency room. It would enable people to have a regular doctor, not just depend on the emergency room, because they would be able to go for different things. It help women who become pregnant would be able to make sure that they're having a good pregnancy, that they're getting the vitamins and the medication and the care that they need in the pregnancy stage, so that maybe there wouldn't be issues in the early stages of pregnancy, so there might not be issues later, or when the baby is born, things can already be taken care of.
So, for those in favor of expansion, what is the most common expression of support you hear from constituents when you're out knocking doors?
Uh, Kansans, people in the Midwest, are notoriously like to look out for their neighbors. And people in District 98 and all across the state, they don't want 150,000 people in our state not to have health care. Uh, health care is a right, and people should have it available to them. And we have a system set up in this state right now that right now we have people that don't have that right, and people want their neighbors to be healthy. They want their kids to be healthy. They want them to be healthy so that they can work and be active members of their community. And a lot of people can't do that unless we expand Medicaid.
Okay. And you touched on this a couple times, but if you'll summarize again, what is the most common objection, and how do you address those concerns?
The most common objection is cost. You will hear a lot of talking points that it's just going to cost too much money. We're going to have a lot more people sign up than we're expecting. However, 37 states have passed Medicaid expansion, and I think maybe the first 10 to 12 that did had issues, but all the ones that have come in since have kind of seen how things have gone. They figure they have more of a guideline of what's going to happen when they expand, and the last states that have expanded have not seen any of those issues, and Kansas would not see any of those issues. Um, it's kind of a hollow talking point now because so many states have expanded. There, like I said, there's 37 that's expanded now. There are at least 2 more that have it on the ballot coming in 2020, and will probably be passed by those states by the people, because the people want it expanded.
Okay. And Medicaid expansion is it's one of your primary concerns. Do you think that it is at the top of the list for the people in your district?
Yes, I believe it is. I believe it has been since it really kind of came up as a campaign topic around 2015. That was one of the 3 top points I had when I was elected in 2016. Was Medicaid expansion, getting the tax code fixed, and trying to make sure that we're funding our education to a constitutional level. And in the 2 years I was there, we got the constitutional level on education. We also changed our tax structure back, so it's more of a 3-legged balanced stool instead of having it on the backs of hardworking Kansans. And like I said, we passed Medicaid expansion in the House, but it got vetoed. But those 3 things were the top of my priority, and those were the top 3 things of priority of the people in District 98, which I spoke with campaigning, and I believe it still is. Unfortunately, the current representative has repeatedly say he will vote against Medicaid expansion when it comes up again, Can Care expansion. Our governor is a very strong supporter, Governor Kelly, of Medicaid, and she's actually made it a point to make sure that that's her top priority in the legislative session this year. She has worked and come out with a compromise with the Senate Majority Leader, Senator Jim Denning, and it is believed that a form of Medicaid expansion will happen this year, although the Senate President, Senator Wagle, is quite defiant about it, and she may very well try to do something to try to make it so that it doesn't come to the desk of the governor again. So that we'll have to wait and see on that. But there is progress being made. The majority of people understand that we need it expanded. It's just trying to get through some of the hurdles that some other groups are trying to put up.
Okay. What is something that you think demonstrates your personal dedication and care for this issue?
I don't know if it demonstrates. It's just me as a person. I want to see. A lot of people don't understand. Medicaid expansion also impacts the schools and students, kids that are in school that need services for mental health or physical health, and the school district would take care of some of that. Where if we had expanded Medicaid, the school would be compensated for some of that. Now they're not, and mental health issues are becoming a huge issue in the communities and the schools, and this would help support the schools, but most importantly, it helps support the kids and the citizens that really need this help. And so the reason I'm so passionate about it is because these are the people we're supposed to be taking care of, and some people are just turning their back on them, and I feel like it's my job and other people's job to make sure that we're not going to turn our back on them. We're going to make sure that people recognize what is needed, that these people need our help, and we have the ability to do that, and we should do that.
Okay. And so this next question, we're going to split into two scenarios. So you already explained that there's a potential possibility for Medicaid expansion to occur this year prior to the election in November. So one, if it is expanded, and two, if it is not, what is a specific and deliberate action you intend to take regarding the issue once you return to Topeka? So first, if Medicaid is expanded and makes it through to some degree, how will you continue that fight or support it? What do you see happening with you in office?
Make sure that we are getting information about what sort of positive impacts it's having on rural hospitals, what it's doing to the job market, and helping with if it means that we have to get more nurses hired because more people are going to the doctor. Make sure that we have enough doctors. Right now, one problem with it, because of not expand, a lot of doctors and hospitals, well, doctors, personal doctors, aren't seeing near as many people that have Medicaid because they're not paid very much by Medicaid either. So they have a limit on how many people they'll accept. Hopefully, when this would get expanded, we can make sure that that percent of pay that they're getting is up a little bit more, and so that doctors will open their doors to more of these Medicaid patients to make sure that they're getting their care that they need, but also making sure that our rural hospitals are being able to utilize the monies that are coming in, and that they're focused on doing things to improve their services and to make it possible to reach out to those that maybe live quite a ways away from the hospitals. Maybe some like programs where they can go into different communities and work with people that can't drive into the hospital all the time.
Okay. Now, scenario two, if it is blocked in the Senate or for some other reason does not get expanded, what is a specific thing that you intend to do when you get to Topeka?
Make a lot of noise. I will go up there and I will fight to get it expanded, just like I did when I was up there before. I will talk in committees. I will get facts. I will explain to people. I will try to talk to my colleagues, Republicans, Democrats, Independent, it doesn't matter, because it takes everybody up there working together to be able to get something like this passed. And as I said, I believe the majority up there already knows that it wants to be passed. The majority of Kansans want to see it passed. It's a matter of getting over some groups that may want to fight this for whatever reason and trying to make people see that maybe they aren't really looking at the whole picture. But I would just be a very strong vocal advocate for it as I was before.
Okay. And with that, is there anything else that you would very much like to say to people regarding Medicaid expansion and care expansion?
I think it is vital for our state and the health of the children and I don't necessarily like the term working poor, but people that work and still can't make ends meet, people that are barely scraping by, a lot of those people are falling in that gap. They need to they have the right to be healthy and to be able to go and be healthy when they go to work and be active in their community. And by making sure that they have health care that's available to them, that's affordable to them, is of the utmost importance. And people in Topeka, in all branches of government, need to remember that, and they need to focus on that.
Okay. All right. Well, thank you very much for talking about this today.